Hi, my name is Chelsea Harris, and I am the director for Roche Diagnostics Global Access Program in the EMEA and LATAM regions, and I'm now based in Nairobi, Kenya. I'm excited to be here today to share more about my experience as part of the WomenLift health leadership journey over the last year and tell you more about my leadership project focused on breaking barriers to cross-sector career mobility. To provide some personal and professional context, I applied the WomenLift's leadership journey in the fall of 2023 while I was at my prior organization and based in San Francisco. But in early 2024, as the leadership journey was kicking off, I started to look to transition into a new role. This informed how I approached the leadership journey in a few ways. First, regarding the leadership project, I took this moment of transition as an opportunity to explore a topic about transitions, one that has defined my own path in global health and that I believe is really important for the global health community writ large, and that is cross-sector career mobility. I also use the leadership journey and the gifts of the space and support that it offers as a chance to be highly reflective about my next steps and really use the tools and insights from the journey to step into my new role with greater self-awareness and intentionality about my leadership style. Which brings me to today, where I'm now based in Nairobi for the role at Roche Diagnostics. I'm incredibly grateful for the community that WomenLift has provided over the course of this massive professional and personal change. Now, shifting to my leadership project. The issue I wanted to look at was women struggle to shift sectors over the course of their global health careers. This is something that I experienced personally, and I've also heard from numerous others that they feel pigeonholed in their current sectors. This results in a siloed global health ecosystem where sectors are trying to solve shared challenges through narrow sector specific lenses. So my project really seeks to highlight the individual and institutional obstacles women face when trying to change sectors with the goal of starting to shift the thinking and actions around this. Now, I'll note that I don't think this is an issue unique to women or global health, but given WomenLift's focus, those are the lenses I decided to apply for the project. So I think this is an important issue for several reasons. Over the last decade, there's been almost universal acceptance that cross-sector solutions are needed in global health, but we are not seeing this in diversity of hiring practices and greater workforce fluidity. Second, there are ramifications at both the individual and institutional levels. Women have fewer opportunities to grow and influence when they are limited to a single sector, and organizations that are recruiting from a narrowly defined applicant pool miss out on diversity of backgrounds, skills, and lived experiences that can bring fresh perspectives to entrenched global health and organizational challenges. And finally, with the shift towards greater localization impacting what sorts of roles make sense to remain in the global north, I think greater career optionality will be increasingly important for everyone in the coming years. So my project centered around structured interviews with several different groups of women, successful switchers, aspiring switchers, as well as hiring managers and recruiters to understand how they think about candidate assessments. To date, I've done a total of 12 interviews and I am continuing to schedule more. I won't have time today to share the details of my findings, but I will give you a taste of the actionable learnings that have come out of the conversations I've had. The learnings map really nicely to WomenLift's spheres of change, specifically the individual, institutional, and societal. At the individual level, these are the things that are within the realm of women's control when thinking about switching sectors. So some of the findings here are that really clear branding, personal vision, and motivation are critical, as well as a focus on how you do the work as much as what you've specifically done. It's also really valuable to connect with people in the target sector for advice and material review. Now, looking at the next layer, that's really hiring managers and recruiters and what sorts of changes can be made at the institutional level to increase cross-sector career mobility. Some of the opportunities to start to shift this are best practices around creating thoughtful job descriptions that focus not only on achievements, but also abilities, as well as setting sector diversity as a criteria for initial resume pools. And then in terms of what this looks like at the societal level and how I see this ultimately manifesting in broader change is that by bringing awareness to this topic at the individual and institutional level, there's an opportunity to create a future cohort of hiring managers and leaders, many of whom are hopefully in the room today, who will be committed to cross-sector diversity through hiring. So what comes next? First, there's some additional data collection and analysis that I would like to do to increase my sample size and also get a better picture of the baseline situation. How big of an issue really is this today within organizations? And then there's dissemination, including hosting a possible event with WomenLift for the alumni community in the first half of this year, where I can share my findings and also give voice to some of the incredible women I have interviewed. In closing, I want to take a moment to thank the entire WomenLift community, both the staff as well as my cohort members and the alumni. I have felt so supported through my job search and transition to Kenya, and the reach of the WomenLift community has made it feel less daunting. These photos from my first 2.5 months in Nairobi are a testament to the power of this network. I've not only been welcomed by the East Africa community, but have also seen many North America peers as they've passed through for work. I think it's a living example of the scale and ability of WomenLift to truly be a cross-cultural, cross-border movement for women's leadership change. Thank you so much for the chance to share with you today.